everyone, welcome back to my channel. If you're new, my name is Dr. Baptiste. I work as a portfolio GP. On my channel, you'll find loads of useful content to support you on your medical career journey. So why not consider subscribing? As always, if you enjoy the video, then make sure you give it a thumbs up. So it's unusual for you to see me here on a Monday. Usually my videos go live on Friday at 6 p.m. as you know, if you're a subscriber to my channel. But I have decided to try and incorporate another video, a second video into my weekly posting. They're going to be much shorter videos, 5 minutes. So as you can see from the title of the video, it's going to be 5 and 5. So 5 clinical tips in 5 minutes or thereabouts. And the topic for this video today is all about medications or medication histories. As you know, when you take a clinical history, there are certain things and certain questions you have to ask, and a part of the history taking is asking some questions about medications. Always review the patient's medications. Even if you are talking to them about something else, have a quick look at their medications. In general practice, our records are electronic, so we have access to the patient's medical history. We just click a tab and we see their medications. We can see current and past medications. We can see acute and repeat prescriptions. Even if the patient comes to you with something that's got nothing to do or seems to have nothing to do with the medications, it is worthwhile just going through their medications and even just confirming the medications with them too. There are appointments for medication reviews in which you will go through each medication with the patient. Maybe why was it started? How are they getting on with the medication? If it's an antidepressant, for example, do they need to go up on the dose? Are they happy and stable with the current dose? Are they getting any side effects? So there's a few things you'll have to ask in the medication review, but usually we will have dedicated appointments for this. So there are some questions that you should ask in a medication history or when you're looking at the patient's medications. So go through each medication in turn, go through the frequency, timing, and the dose of the medication. Sometimes patients aren't taking them as they were prescribed. A key question to ask is, are they still using this medication? So again, this is a good point to ask them if they still need the medication. If not, you can remove that from their medication list. And again, tied into this point, if they've stopped the medication, did they stop it themselves, or was this a conversation that they had with a doctor or another healthcare professional? A good thing to always ask about is over-the-counter medications. Sometimes people take medications over the counter. This could lead to drug interactions. So a drug that they're taking from over the counter could interact with a drug that we have prescribed. So again, it's always important to ask about this. Now, there are specific questions for certain medications like statins or methotrexate, for example. Just a few more points in terms of the medication history. Always check for allergies when you're going to prescribe a medication. And again, it's part of the medication history, so it's always a good question to ask. And again, when you ask about allergies, ask exactly what their allergic reaction was. Sometimes people mention a side effect, which is not an allergy. And again, ask about the severity of the allergy if it is a true allergic reaction. So those are actually more than 5 tips in 5 minutes, but you get the gist of what I'm trying to do with these videos. So let me know in the comments section below if you found them useful, and as always, give the video a thumbs up if you liked it and subscribe if you haven't already. I will see you again this Friday.